if anybody wants to watch them afterwards or share them with a friend, you're most welcome to do so. So I will get started. Thank you all for joining us today. Our presentation is on building a plan for living well in your senior years. So this is part 2 of a 2-part series. In September, we talked about building a team, and today we'll talk about building a plan. So we have a quick, Heather, do you want to put everybody on mute except for me? Or if you can, you guys put yourselves on mute, that would be helpful, thanks. So we have a quick 1-minute video, and last time we shared this video on a presentation, it didn't work for everybody, so it depends on your technology. If it doesn't work for you, just hold tight, it's only 1 minute, and if it does work for you, it just is a nice little explainer of our services that we have. And I have to just give a shout out to Broken Pencil, who made the video for us. We actually won this in a kind of competition, and so they made this video for us for free, and we're really quite proud of it. So on to the video really quickly. Okay, so moving on to our slide. I hope that worked. Heather, did that work on your end? Judy, did you see that? Good, excellent. That's it always kind of brings tears to my eyes because we're so proud of the work we do and love it so much, and that really explains it so nicely. So a little bit about who we are at Proactive Seniors. So we're an advisory service, and we started in 2016, and we help seniors and their families in Calgary, Edmonton, and Kelowna. And we help to make sure that they have the information and the support that they need to make their best choices and decisions. Our team members consist of people with backgrounds in seniors housing and in home care, in gerontology, in physiotherapy, occupational therapy, nursing, and pharmacy. So we have a really educated and experienced team that we can draw on to help make sure you guys have the information and resources that you need for support. So today's presentation is planning ahead to live well, and we're going to discuss how creating a plan can help support the goals of being healthy, happy, and safe as you progress through your senior years. So first, let's start with why. Why plan ahead? Most seniors want to stay in their own homes as long as they can. 80 to 90% of seniors aged 65 will say that that is their goal. But by age 80, about 65% of seniors are still living in their home. So at some point, a significant number of people do move into supported living or retirement residence. To be successful with this goal, you must have relatively good physical and cognitive health, and you must be safe from falling or other preventable accidents or injuries. And when these physical or cognitive health situations change over time, you need to be prepared to get the help that you need to accommodate for what you can no longer do on your own. And the issues that many seniors face is getting the right help at the right time. Hoping for the best is not a good plan, but unfortunately, it's quite a common approach. I'm sure you've met some seniors who really, they don't want to talk about or think about the future, and they are just hoping that everything will work out. Well, what we see happens when seniors don't have a plan for their coming years is that family members, primarily their adult children, can get very worried and anxious, and they often start to put pressure on their parents, and this can cause stress and strained family dynamics. Without a plan, the primary caregivers, whether that be a spouse or an adult child, often become burned out and may become ill themselves. Important decisions that are left until a crisis occurs are often made with limited information, limited options, and may end up being poor or disappointing choices. Costs escalate when choices are left to the last minute, and people end up having to pay a lot more for private services because public services have limited supply, high demand, and will often have long wait lists. And finally, when access to care is delayed because of not being prepared to have help at the right time, there's often a negative impact on health outcomes, which is really a shame when that can be avoided. To further emphasize why it's important to plan ahead, we can look at a quote from Dr. Avery, who was the past president of the Canadian Medical Association. In 2012, a report on seniors' health care, he stated that the healthcare system is not working as it was designed to when it comes to the senior population. He goes on to say that we provide high quality care, but often patients have waited far too long to receive it. In fact, there are dozens of reports and studies from federal, provincial, and non-governmental agencies that have similar statements. Many of these reports highlight how poorly seniors fare in our acute-focused healthcare system. They go on to make recommendations that seniors should be planning ahead for their future in terms of care requirements, their finances, their medical decision-making, and who their caregivers should be. But there is acknowledgement that there are very few systems and supports in place to help families plan ahead, and that the onus is on them to do so. We concur with Dr. Avery. We do have a very high quality healthcare system. If you're in an accident or you have a serious illness, our hospitals and specialists are truly excellent. But where our system is failing is that there isn't enough support and attention to preventing illness, preventing injury and accidents for seniors. And as we age, we do not fare well with aggressive surgery and medical interventions. We need to be more proactive to help keep older adults healthy and safe instead of relying on fixing or healing them when they're ill or injured. Unfortunately, with the current increased pressures on our healthcare system, we have heard more than a few times that families have been advised to wait until a crisis situation occurs and then bring their loved one into the emergency room for care. And this is a very dismaying approach to caring for our older adults. I'm really glad you're here today to learn how to build an understanding and how to avoid this from happening. So let's get into the details on how we create a proactive seniors plan. I'll walk you through the process that we take when we're helping families create a plan. There are 4 main steps to consider. Our approach is to go through these steps in a family meeting format, and we like to have as many family members as there as possible. Ideally in person, but we often use video conferencing so that out-of-town family members can join in as well. So if you're doing a family meeting with your family, make sure to include everybody who wants to have a say in how this plan is developed. This helps to be sure that we can incorporate everybody's viewpoint, and it also helps to build a consensus or build alignment so that everybody's on the same page and working cohesively towards common goals. Now, sometimes family dynamics can be challenging, and it can be helpful to have a facilitator who's outside the family to help move these discussions forward and keep them productive. And so that's why it often is really helpful to have someone like us work through the family planning process. Sometimes there isn't any extended family to join in which case there's no reason a senior can't go through these steps on their own or ask a friend or an advisor to help you. We do this planning work in 1 or 2 meetings, but if you're doing this on your own, you can take it in smaller bites. Just be sure to keep the momentum going and try to keep working towards building a plan over a reasonable period of time. I suggest you don't go longer than a month, or else it never really gets done. So, step one is to do two very important things. The first is to identify what your aging well goals and wishes are. These goals and wishes are the target we are aiming to reach with the plan. Sometimes seniors are hesitant to open up to this planning process if they feel like they're going to be pushed into a certain direction or lose their control. But by focusing in on what their wishes are, it builds a confidence that their goals are the focus of this endeavor. We also like to hear the goals and wishes and the worries and concerns from the senior or the seniors and from their family members. Oops, I missed a line here. Let me back up. Okay, we also want to know what the primary concerns and worries are. What is keeping you or your loved one up at night? What is causing stress or anxiety? We like to hear the goals and wishes, the worries and concerns from the senior or seniors and their family members. And there will often be some overlap in the goals and the concerns, but there'll be some differences too. So that's why it's important to hear from everybody. One of the most common goals we hear is that I'd like to stay home for as long as I can. But other common statements might be, I'd like for my spouse, who's my caregiver, to have more support or to have a break in caring for me. Or I want to downsize my home or move into a more supported or social living environment. The adult children will often say that they'd like to see that mom and dad have the support that they need so that they don't have to struggle, or that they'd like their parents to stay in their home, but they want to make sure that they're safe if they're going to do so. Sometimes we hear the adult children saying they'd like their parents to move closer to where they are so that they can be more part of the plan of helping them. So both the wishes and the worries help to form the foundation of the proactive seniors plan. So that's our very important first step. Step two is to become a detective. You want to dig in deep to all the facets of the older adult's life and create a really comprehensive list of all of the current or potential problems that could negatively impact them aging well. We find that this is where it can be very valuable to work with an experienced professional. We know what to ask and what to look for to identify potential risks and challenges. The goal here is to try and get ahead of the potential issues and crises by being proactive and identifying before they become critical. When we do this, we go through a structured process so that we don't miss anything. We have about 200 questions that we inquire about, and through these questions, we can identify what the potential issues are for this individual or couple. The list of issues is different for everybody, as everyone has a unique situation, and that's why a personalized approach is so important. There's no one size fits all in understanding what a person's unique situation and challenges are. When you're doing this, try to consider the following categories to dig into: medical issues, cognitive and mental health issues, and those are different. Cognitive is how is your thinking capability, and mental health is how is your emotional wellness. So physical and functional limitations, how one is managing with their own personal care and in their home, a review of supports that are already in place, and how they're functioning from a social perspective, what the house is like or what sort of housing or modifications are needed, and finally, how is their financial and legal preparedness, including such things as access to government benefits, grants, tax credits, and documents such as powers of attorney and personal directives. I'll give you an example of our client who I'll call Ella. Ella is an 82-year-old widow living in a condo on a modest fixed income. She's a very accomplished artist. Her only child, Adam, is her primary caregiver, and he reached out to us because he could see that she was declining quickly over the past year. And boy, oh boy, have we seen that a lot over the last 2 years with COVID. He was worried that she might need to move into a senior's residence, even though he knew she didn't want to. Adam was getting close to being maxed out in terms of his available time to help his mom with day-to-day things. His job and family commitments were very busy. For Ella, Her goal was very much to stay in her home as long as she could reasonably do so. And Adam wanted that for her as well, but with the way things were going, he was worried about her health decline and her safety. So even though she was living at home independently, she did have a fairly significant list of issues that we identified as needing to be addressed. And I'd say on average, we come up with at least a dozen issues for each senior that we're working with. There's always things that could be done better or that should be talked about. So Ella, some of the issues with Ella, she was quite confused and disoriented. She didn't really know what day of the week it was. She was missing appointments, losing track of her bills, and not following through on things that Adam had asked her to do. She wasn't sure what the medications she was on were for, and she wasn't very good at taking them on a consistent schedule. She was lonely as she didn't have much of a social network, and she wasn't getting out of the house anymore. Her hearing wasn't very good, and she was uncomfortable being in social settings. Physically, Ella had sore knees and a sore back. She'd gained some weight in the past few years, and moving around was getting quite difficult for her. She was not eating or sleeping well. She was primarily eating packaged foods that she would pick up from the local convenience store, and she'd taken to sleeping in her recliner chair as it was hard to get in and out of bed. She had no support coming in other than her son. She didn't have an updated will since her husband had passed, nor a personal directive or a power of attorney. So this gives you an example of the things that we discover when we're a detective. So we want to look very broadly at health, wellness, safety, and you want to come up with a detailed list of all the possible things that are not going well or look like they have the potential to be a problem in the future. Step 3, addressing each of these issues that have been identified with a specific plan that will either eliminate the issue or minimize the risk as much as possible. This is where knowledge about what supports and services and programs and clinics and resources are available comes in. It can be very difficult to find this information because the public health system just tends to know about their own public services and programs. And it really depends on who you talk to. There's so much going on that a lot of people in the public health system don't know what all the programs and services are that they offer. Specifically, family doctors are often really busy with what they do best, and they're not a great source of resources or information on programs and services. So you need to find the right access point into the system to know what is offered. Similarly, there's lots of supports available in the private sector. It's kind of hard to find that information if you don't know what you're looking for. And there's lots of supports available through the government programs and government benefits, but these can be hard to find and they can also be hard to access because there's usually an onerous amount of paperwork that needs to be filled out. So this is why it's important to start the planning process early so that if you're doing this on your own, you have the time to do the research into what supports are available and the time to reach out to these resources and find what the timelines are and what the criteria and the eligibility is. When we create an action plan, we then create an action plan for each problem or concern. We make sure to be very specific. So who, what, where, when, how, and why. You want to know what the support resource is that is suitable for the problem, how to access it, when to access it, because a lot of stuff have wait lists now, particularly over the last couple of years, and then where to find this information. The more detail you can provide when you're creating this plan, the better. Sometimes one solution will cover off more than one issue. It's also important to identify who in your support team is responsible to move forward with that action. Some people in your family or friends or professional support team will be better suited for some tasks than others. So sometimes we'll have family members that are out of town and we'll delegate some tasks to them that they can manage from being out of town. For example, maybe helping to order their parents' groceries each week. And if they have family in town, then we would delegate tasks to the family that are able to do the stuff that needs to be done when you're in town. So it's about picking who's the right person to move these tasks forward. We like to encourage people to find the balance between using family and friends to provide support and then outside service providers. You want to make sure that the people you're asking to help you are comfortable in that role and that you spread out the tasks among a broad group of supporters. We did a webinar in September, as I talked about earlier, about building your team, and you can refer back to that by looking on our website about all the different people that you can put together to build that team to support you. When we put the actions in, we then put the actions in order of urgency, making sure that the things that are high risk are addressed first, and the things that are not as urgent are moved to a later schedule. It's really important not to overwhelm yourself or your loved one by having too many tasks to do all at once. When we were starting off doing this about 5 years ago, we would give people this list of things that needed to be done, and it was always super overwhelming. So now we break it up into things to do each month, and it's a little bit easier to wrap their mind around. So returning to Ella, for example, we took her to her doctor to get her medications reviewed. He was able to take her off a couple medications that she no longer needed, and he helped her to understand what the remaining medications were for, so she better understood when to take them and why. Public home care was set up so that they would come in once a day to help her with her medications and to help her shower a couple times per week. The doctor ordered blood work to see if there was any medical reason for her confusion, such as a potential infection, which we see all the time. But thankfully, there wasn't in this case, but it was worthwhile checking. We took her to a hearing clinic for testing. In fact, she had significant hearing loss, so they ordered hearing aids right away. And being a lower income senior, she qualified for funding, so there was no charge for that. Ella opted to delegate to her son management of her finances and bill payments, so she didn't have to worry about any more. To do so, she had to prepare and enact a power of attorney. We set her up on a low income grocery delivery service so that she could have better quality food to eat. And we had AHS occupational therapy come in to assess her home for safety, and they ordered and installed bath seat, shower handle, safety bars, and a railing for her bed so she could get in and out easier. That way she was able to sleep in her bed instead of in her lazy boy. We helped her apply for Access Calgary so she'd be able to get around town, and this freed her up to be able to participate in an adult day program twice a week. And because she could hear better and she was eating better, she was much less confused and much more interested in socializing. At the day program, they realized her art talents and they had her teach some of the art classes to the other participants. She loved the day program and they loved her and was very happy going there. This, plus a number of other issues, took about 4 months to work through, but at that point, she was so much better able to stay in her home completely safely. She was much healthier, her cognition was better, her mental health was better, and she was able to retain her independence by having support. And that's the key thing. You retain independence by accepting help and support. So it's just a little cartoon. Here's your support, Dad, and here's mine. So the daughter is saying the dad needs a cane for his support, and she needs a home caregiver for her support. So I think that's kind of a good point that we want to make sure we're helping to support everybody in the relationship with the services that they need. So care services that seniors often require. It's such a long list, but just to cover a few, we help people access home care. Balance and fall prevention clinics, make sure they get hearing aids if they need to. Driving cessation is something we talk about a lot. How to transition from being a driver to not being a driver, and what kind of alternative transportation is available for you. Personal emergency response systems, delivery of meals and groceries, making sure the home has the right modifications, suggesting downsizing or estate companies that can help with people getting rid of and thinning out their stuff if they know they're going to move at some point in time. The list is really endless. There's lots of help out there. It's just really important to make sure you have the time to start planning and looking for it so you know what you need. Okay, step 4 in making your proactive seniors plan is to consider contingency planning. So we feel it's very important to talk about the what ifs. And this is best done after we've done that initial plan and created a plan that addresses the goals and the wishes. So at this point, the senior will often feel ready to consider discussing what their choices and wishes are if their plan doesn't go according to what we're hoping. So this is very important. Plans are great, but without them, we would see little to no progress towards achieving a goal. But we have to be realistic and realize that things can change quickly and unexpectedly sometimes. And it's important to think through what one's preferences are prior to being in a crisis situation. So for example, we like to discuss alternative housing preferences. So even though most of these clients are wanting to stay in their home, we like to make sure that we know where they would go if they had to move somewhere. So we spend some time identifying what their best options are for seniors housing, maybe even touring a few places. So they have that as a plan B, and we don't have to do it under crisis if it's needed. We also like to talk about caregiver backup. If the spouse is the primary caregiver and something were to happen to them, then who needs to take on the role that they are no longer able to do? Finally, we like our clients to consider what would need to be in place if they were unexpectedly to go to the hospital. Who is it that they look after, whether it's a spouse or their pets? And if they're the caregiver, making sure that there's a plan for the person that they were caring for. So these Plan B conversations are hard to have, but they're really important and they're easier to do after we've already considered the Plan A, which is trying to meet the initial goals and wishes. Finally, keep in mind that plans often need to be adjusted. So we like to follow up regularly and check in to see how things are going and make adjustments and tweaks as time goes on. So for those of you doing your own planning or helping a loved one, please remember this is a fluid process. It's okay to make adjustments or to change course as things change in a person's life. So, what are the outcomes from building a good proactive plan? Well, it's well worth the effort. Some of the less obvious benefits are that we can optimize who is helping and how. We find that sometimes there's a discrepancy in families on who wants to help and what they're comfortable doing. It can go both ways. Kids want to help, but their parents are not wanting to be a burden, so they don't let them in. And the opposite, where parents have high expectations of their children to help, and the children are simply not able or comfortable with some of those requests. So by doing this planning process, it allows you to optimize everyone's ability and desire to help in the roles that they want, and then to fill in the gaps with outside services or other supports as needed. So going through this planning process really helps to align who is best and most capable of helping where, when, and how. Another benefit through this process is that clients become aware of support and programs that they wouldn't have known about before. And so once you're aware of programs and services, you're much more likely to use and access them. This process allows seniors to preserve their choice and independence. Seniors are very worried about losing these two values, and planning ahead helps to safeguard them. You can actually stay independent and self-deterministic longer when you accept help along the way. But getting help on board in a timely manner, often much earlier than they would have sought it otherwise, seniors can stay healthy longer, reducing the risk of hospitalization or injury. And when you have time to strategize, seniors can access many free services or subsidized services. Left too late, the lower cost options are often not available, but if you plan ahead, you can access some of those services that don't cost as much. And finally, having a plan allows families to enjoy their time together without feeling anxious or at odds with each other. And that's really, really important. We want to preserve those relationships. An analogy that I think resonates well when you're trying to explain to someone that they should consider planning ahead is to compare wealth planning and health planning. Everyone knows the benefit of getting personalized professional advice to create a financial or retirement plan. a plan that's based on their goals and wishes. So similarly, seniors need to get support in creating a comprehensive, individualized health and wellness plan for aging based on their goals and wishes. They go hand in hand, and it makes sense to do both. So, in summary, being proactive in planning ahead to live well has so many good outcomes, such as improved health and well-being for everyone, for the seniors, for their spouses, for caregivers, for the adult children. It helps people to be prepared with the right questions to ask the right services and programs at the right time. It makes sure that you've got actionable steps with a specific timeline so you're actually achieving goals. Helps to support the family caregivers. It makes sure that people have the right housing for safety and support. Make sure that people understand the anticipated future care costs and needs. By going through this planning process, you can understand earlier what you need to spend money on and what you can access through public services. It helps people to be able to make educated and informed decisions and maintains maximum amount of choice. And it allows families to spend quality time together with everyone feeling calm, confident, and optimistic towards the future, which is what we want. And that is our presentation on planning. And we can open this up for questions if you want to unmute yourself, or else maybe Heather, you can read off any questions that might have come in over the presentation.
First of all, I just want to apologize. Oh, sorry, go ahead. Somebody was going to ask a question.
I don't hear them now. Go ahead, Heather.
I was just going to say, I know a few people are having an issue with the slides, and the slides are blocking and then coming back and blocking and then coming back. So I apologize to anyone who's having that issue. That's why I took myself off camera for a little bit, hopefully to help it. I will be sending out the slides with the video link as well. So if you've been having those problems and you want to review them, you will definitely be able to do that as soon as we send them out, which we do as soon as the uploading and all the tech parts are done.
Oh, that's so weird. Yeah, I'm seeing here that people were getting kicked out. Oh, that's weird. Yeah. Technology, it doesn't always work like you'd hope.
Thank you very much, though, Heather.
Oh, yeah. You're very welcome. I hope that Kathy's had some things to say that have resonated with you and been of interest.
Yeah, definitely. How about the part 1? Because I missed that. I don't know. Or would you be having it anytime soon?
You can find it. It's on our website. We recorded it for you. Yep. So you can go and listen to it. Just go onto our website under education and it'll be there with all the other ones. Yep. So feel free to listen
education.
To that.
Okay.
Yep. So the way that works is our education has the slides. So when you click on the slides, on the first slide, it has a link to our YouTube page, to the specific.
Okay.
So you can
Thank you so much.
No problem. You can also find us on YouTube just by Googling Proactive Seniors YouTube, and it will take you to our page, and it has all of the recordings on there as well.
Awesome. Thank you so much. Because you can, I can at least listen or view it on and on so that it enters my brain also.
So it sinks in. That's right. Watch it as many times as you want. You'll be tired.
Because it is, brain is slowing down, I think. As I'm aging.
We love that people are using them as resources. That's why we do these. We really just want to.
Thank you so much.
There.
Yeah.
Awesome. Thank you.
You're welcome. Any other questions or things that we can answer or talk about? Nope. All right. Well, we'll post this on our website. And always just feel free to reach out to us. If you have any questions, just give us a call or an email and we will answer them as best we can and make sure that you have all the information that you need for your decision making.
Thank you.
Good. Oops. Can't hear you anymore.
Is there anything else to share?
No, this is all.
I will go into the.
Yeah, you can go and see all of our other presentations. Yeah, but if you have any questions, just reach out and we can answer them for you.
Awesome, awesome. Thank you very much. I will take your leave.
Okay, thanks. Bye-bye. Thanks,
Bye-bye.
everyone. Okay, thanks, Heather. Thanks, Judy. Bye.